Welcome, everybody. I know we are just at 6 o'clock, so we're welcoming everybody in. It's so good to see everybody's faces on this very chilly day here in PA. I know Erin and I were just saying we have our blankets on because it's very chilly for us.
I talked to someone this week who said she had snow up to her waist, and I thought, that's a lot.
And I'm
And
complaining about 20 degrees. So
that's exactly what I thought, but here we are with blankets and warm beverages keeping us cozy tonight, so that's okay.
Well, thank you everybody so much for taking some time out of your evening and especially out of this busy season, a little time for yourself. Tonight, I am very excited for our Her Speaker series, which is our first education event of December, actually, which is Feeding the Mind, Nutrition for Cancer-Related Cognitive Impairment. So, we're going to talk tonight about nutrition's role in managing chemo brain and supporting cognitive function during survivorship, throughout treatment, and beyond. But of course, our virtual education events are not possible without the support of all of our sponsors. So, our virtual education events are presented through UFH Connect by West, Merck, Lilly, Novartis, and Gilead Sciences, with support from gold sponsors Pfizer, GSK, and Daiichi Sankyo, and are presenting our supporting sponsors AbbVie, Tercera Therapeutics, and Veristem Oncology. So thank you to all of our various sponsors because without them, we could not have all of these UFH Connect education segments. So, like I said, this is really our first December education. Erin will talk briefly in a bit about our upcoming December education. But for those of you who do not know me, my name is Aubrey Red. I'm the culinary nutrition manager here at Unite for Her. I'm joined by my wonderful colleague, Erin Pellegrin, who is our senior nutrition director and education director as well. Just a little bit of Zoom housekeeping. If you have not previously been on an education event or you don't use Zoom too often, we just ask that you mute yourself if you are listening in, just so that there's no background noise and we can certainly help you if you need assistance. Erin is going to start today's presentation. We're going to have a little bit of questions after hers, and then we'll go into my portion of the presentation. If you have any questions, you can raise your hand or you can put them in the chat. We'll be sure to pull any questions from the chat to make sure they get answered. And we'll be recording the presentation today that can be viewed on our Her library. So if you visit www.uniteforher.org/her library, that will bring you directly to all of our recorded education segments, like some of the ones we have upcoming.
Amazing. And like Aubrey said, although tonight we are kicking off December, we've got several more segments coming to you to fulfill our month of December. And the first starts with tomorrow. So if you have been following along our UFH Connect video library, you know periodically we like to highlight the incredible work that our other nonprofit partners do to support the oncology community. And so tomorrow we have our Ask the Expert partnership focus. And I will be joined by the executive director and founder of FORCE, Sue Friedman. So, FORCE is an acronym, Facing Hereditary Cancer Empowered. And they do some of the most incredible work, education, resources, going through clinical trials and research that comes out. And they serve the entire oncology population of patients. So I'll be really excited. We'll be highlighting the incredible work that Force does, the resources they share, the education that they put through. You don't have to register for it. We are streaming live to our Facebook page. So that's tomorrow, Friday, December 5th at 1 p.m. Eastern Time. Find it on Facebook, follow along. But there is a lot of great work that they do. So definitely check that out tomorrow. And then we've got two more events coming to you next week to round out the year. And I can't believe we are saying that. So we've got great segments next week. I mean, tonight's great as well, but a lot of fun coming to you. So next Wednesday, December 10th, 5 p.m., we have back once again Jacqueline Carmody from Twist Out Cancer. We are doing art therapy together. And Jacqueline's theme is all about the art of cozy, finding comfort through Hygge. I'm probably saying that wrong. She will correct me next week, but we know that that means cozy in Danish. And so our segment next week, please join us. It's a show and tell segment. So she'll be using narrative therapy style training to give us writing and word prompts to create a cozy environment. Guests will also be encouraged to bring your favorite mug and join us from a place in your home that you find cozy as we're working together and creating artwork. Jacqueline actually drew some artwork that I'll be sending out to attendees next week so we can be creative together. So I think this is the third or fourth year that we have her back with us in December. So we're really excited to have some art therapy together. And then on Thursday, we have a speaker series. So 1 week from tonight, December 11th, 5 p.m. Eastern Time, we will be joined by an incredible dietitian, Crystal Zuniga, and her topic will be all about muscle matters, fueling strength and health after cancer. So her session will focus on building strong, resilient bodies after cancer and shifting the conversation from weight loss to body composition. She'll be exploring how cancer and its treatments affect muscle mass, fat mass, and why these changes matter for metabolic health, physical function, and overall quality of life. So we hope you'll join us. Again, that's next Thursday, the 11th at 5 p.m. If you can't, remember all of our education segments are recorded. They are all available in our video library, uniteforher.org/UFH Connect. You can also go there to register for our Zoom events, and I'm happy to share those links as we move through our segment tonight. But so much more to look forward to. But before we get to them, I am excited to kick us off for our discussion this evening all about cognitive health. So let me share my screen as we get ourselves started. So, Aubrey, just give me a heads up that that looks good. Excellent. Amazing. So, I am honored to kick off our discussion tonight because this is important and we hear this a lot. So, our segment tonight is all about feeding the mind, nutrition for cancer related cognitive impairment. So, let me do a little bit of reorganizing. There we go. So, tonight, our agenda, what are we going to cover? So, first, we're going to talk about what is cognitive impairment. And this includes discussing its prevalence in the cancer population and why it occurs. Then, we're going to dive into menopause and how estrogen decline affects cognition, because that's also a part of this conversation as well. Then, we're going to bring the two together and I will go through the overlaps and how the two are related, both menopause and cancer in terms of cognitive health, all of which will lead us to Aubrey's discussion as she reviews all of the different nutrition and lifestyle strategies that together support your cognitive health. So, a lot to cover in a little bit of time, but we're excited to jump in. So, first, let's start with cognitive impairment. We may also know this as cognitive decline. Sometimes it's called chemo brain. We'll talk about that in just a minute. But what essentially is it? So, cognitive impairment includes the various problems associated with a person's ability to think, learn, remember, use judgment, or make decisions. Now, you see several symptoms here on the screen, but it doesn't have to be all inclusive. But what it may includes changes in attention. Someone could say they have a shorter attention span. It affects working memory. So a person might find a decrease in their short-term memory. They might have trouble remembering details like names or dates. Someone might say that they're noticing changes in their executive function. So maybe there's difficulty concentrating or multitasking. Some members, and I hear this quite a bit, changes in their processing speed. In other words, tasks may take them longer to complete compared to timing in the past. Verbal fluency, oftentimes I may hear members say they have trouble with word finding. And cognitive decline may not specifically include any of these, But perhaps it's just the feeling of mentally being off. So sometimes there's a little bit more generic nature to this, but all of that is valid and all of that may be happening as a result of a lot of different things that I'll go into. And each person's experience with cancer-related cognitive impairment is different. So different so much that you may be looking at this list and saying, I'm really just noticing changes in my attention. Maybe it's just one thing that's sticking out to you. Whereas others are saying, oh my gosh, all of these, I'm seeing changes in all of these. So it can show up in different ways. And that approach to how you address it is unique to each and every one of your experiences. So, how common is cancer related cognitive impairment? In fact, it's quite common. So, statistics tell us the majority, 75% of cancer patients report some degree of cognitive impairment. And while most patients' symptoms will improve over time, a portion of the population, 20 to 35%, will continue with long-term side effects through their survivorship. Now, I mentioned the correct term and what we like to start using is cancer-related cognitive impairment. But historically, often, how we call it and how we hear it so often is chemo brain. And this suggests that cognitive changes can only happen in the presence of receiving chemotherapy. But we know that's not true. There are so many other treatments and parts of that process that can affect cognitive function. Endocrine therapy, immunotherapy, radiation, surgery, all of which can have an impact on a person's cognitive function. And one final note, CRCI often goes under the radar. So during active treatment, a patient's focus is often somewhere else, right? It's on getting through their treatment, managing their side effects, remembering to get to their next appointments, remembering to hydrate, all these other things. So these sort of cognitive changes may not be, for lack of a better term, front of mind, right? So it may not be until further into the treatment process that a patient may notice these changes or feels the need to bring them up to their oncology team. But having conversations or just addressing your cognitive health early and often is really important. So having that awareness is key because having that conversation and just being attuned to those changes can help you work with your oncology team to hopefully minimize the severity of your symptoms. So let's talk about mechanisms because there's a lot that goes into this. And I think this slide is really great because it justifies what you're experiencing. Not that justification is needed, but sometimes we feel like, oh, I'm just stressed or whatever. But there are real mechanisms that are affecting our cognitive health. So, first, oxidative stress, right? So, we know stress, oxidative stress, free radicals can have an impact on brain cells and slowing overall processing. And when you take that oxidative stress and you pair it with overall inflammation, and having cancer is certainly an inflammatory state, when you bring them together, they can contribute to cognitive decline. First and foremost, by causing neuroinflammation. So, inflammatory cytokines disrupt neural signaling. What does that mean? Cytokines are essentially proteins that play a role in brain cell signaling, particularly in the immune system. And cytokines, one of the major roles they play is helping to regulate immune and inflammatory responses. So, if inflammatory cytokines are present and they're disrupting those normal regulatory pathways, it can lead to inflammation and neuroinflammation. In addition, that inflammation overall and oxidative stress can cause disruptions in the blood brain barrier. And perhaps that weakened barrier can lead to inflammatory molecules entering into and around the brain. And then finally, estrogen suppression, right? So we know a large majority of our members may experience estrogen decline, medically induced menopause, as a result of their particular cancer diagnosis. And we know lower estrogen reduces neuroprotection. So let's dive a little bit more into the estrogen aspect of this conversation. So, the biology of menopause. Estradiol, we know for many of us, is the main form of estrogen that we produce in the body. And in fact, it exerts a significant influence on brain function, particularly in the regions of the brain that are involved in cognition, in mood, and in memory. So, as estrogen levels decline, whether it's naturally occurring or medically or surgically induced, the protective nature of estrogen decreases, contributing to cognitive decline. And this happens in a lot of different ways. First, it leads to reduced synaptic plasticity. What the heck does that mean? Okay. In the brain, we have a part of the brain deep inside called the hippocampus. This is a key brain region that is responsible for learning and memory. It's also highly responsive to estrogen. And in this region, estrogen helps to maintain synaptic plasticity. A synapse is essentially the gap between two brain cells that allow them to communicate. So, this is where those signals travel that send messages and body functions and all of those signals. In addition, estrogen helps to support neurogenesis. And that helps to keep those connections strong. What the heck is neurogenesis? Essentially, this is the process of creating new brain cells. And that we know is important for learning, for memory, and for brain repair. So, as estrogen declines and those processes are not functioning as well, we're seeing this cognitive decline. In addition, decrease in estradiol affects glucose metabolism in the brain. So, estrogen's act on the brain or its role, I should say, is to help regulate all aspects of body energy homeostasis. So, in other words, how our body uses fuel in balance and metabolism. And estrogen in particular helps improve insulin sensitivity, which allows our cells to use glucose for energy efficiently. So, insulin, if you are unfamiliar, is a hormone that's produced, and I often liken it to being a mailman, right? When we eat and we break down our food and we have glucose that we use for energy that is traveling around the body, insulin goes out to the blood, it picks up a glucose molecule, it brings it to a cell to use for energy. So, we want our cells to be sensitive to insulin, but that decline in estradiol affects that sensitivity, leading to potentially increased blood sugars and higher risk for developing type 2 diabetes. And then finally, decreased estradiol leads to increased inflammation. So, estrogen actually plays a pretty complex role in the regulation of overall inflammation. In fact, one of its most important roles is in the production of pro-inflammatory cytokines and the suppression of inflammatory pathways. So, again, if we're seeing that estradiol decline, we're seeing that decrease in suppressing inflammation pathways. So, again, leading to increased inflammation. So, there's a lot of mechanisms at play, but I think it also leads to that conversation around, how important estrogen is throughout the body, not just as part of our reproductive system. Okay, so when we look at menopause specifically and cognition, it shows up in a lot of different ways when we think about how it affects our cognitive health. It can show up by feeling more forgetful. A person may experience word finding difficulties, changes in emotional regulation, slower processing. All of these we know are related to declining estradiol levels. So, interestingly enough, some additional information because I think it's really important to share and pretty compelling information when we start to understand all of which estrogen does in the body. So there are receptors in the brain that are found in both the prefrontal cortex and the hippocampus, and they govern higher level thinking and executive functions. So, as estrogen levels fall, a person may experience those increased challenges with memory, with multitasking, with problem solving, those executive functions. It also plays a key role in regulating the neurotransmitter systems in the brain that influence our mood, our motivation, and our cognition. So, estrogen enhances serotonin activity in both the hippocampus and that prefrontal cortex. And this supports our emotional balance and acts like an antidepressant. So, we're seeing these changes in emotional regulation because as declining estrogen happens, it can worsen a person's depression and anxiety. Estrogen also supports dopamine signaling in regions of the brain that are involved in reward and cognitive flexibility, meaning lower levels can reduce motivation and impair that adaptable thinking, that flexibility thinking. And then finally, estrogen regulates glutamate. So, glutamate is an amino acid that acts as a neurotransmitter in the brain. And in fact, it is the brain's main excitatory neurotransmitter and is wildly important for learning and memory. So again, we're seeing this estrogen important role in so many areas of the brain and so many cognitive functions, and also understanding that overlap with cancer. And that brings me to seeing so much overlap. So when we're talking with our population and we're talking about the cognitive changes as they're going through treatment, but like I said, many of our members are also dealing with a decline in estrogen. There's so much happening together. So, some of those shared symptoms that we often hear, brain fog, memory loss, poor focus or attention span, poor concentration, are happening as a result of both conditions. And then we've got those shared drivers, right? Estrogen suppression, sleep disruption and stress, overall inflammation, all of which are affecting our cognitive health. But that's not the only thing. And I don't mean to be the Debbie Downer of this conversation because when you hear Aubrey's portion of it, she's going to give you and help you feel empowered with all of the things that you can do. But there are so many things just to be aware of that can affect our cognitive health. We know that aside from estrogen, medically induced menopause, varying types of cancer treatment, there are other physical and physiological factors that also can aggravate cognitive symptoms. So, sleep disturbances as a result of so many things, hot flashes, right, affecting the quality of our sleep and moving through our day, anxiety and depression, baseline, underlying anxiety and depression, fatigue. We know cancer related fatigue is an experience in and of itself. And then some medications, opioids, steroids, antihistamines. So, all of those compounding with a change in hormone levels, estrogen, going through cancer treatment, all of which can have an impact on cancer health. So, when we think about cancer related cognitive impairment, your experience and the changes that you are noticing really are valid and are happening and for so many reasons, but that's also a good thing because there's so much that you can do in order to support and improve your cognitive health. And this is where Aubrey's going to jump in. But before we get to that portion of the discussion, let me just stop sharing and take a moment of pause to see if there are any questions about what we've covered first before we dive into that nutrition and lifestyle segment. So I don't see anything that's come through. I know we're spewing a lot of information at you, so there may be some digesting happening, but we'll have plenty of time for questions at the end also.
Yeah, absolutely.
All
Well,
right,
if there
great.
are no questions right now, certainly think on them. But
Yeah,
I will, I guess, take it over with talking
wonderful.
about the lifestyle side of things. So, Erin, like she said, she's not trying to be the Debbie Downer. She's just giving you the background, right? So I think in those terms, we wanted to give you this kind of biological background to cancer related cognitive impairment and just cognitive impairment in general. But I'm excited to talk about what you can do to support your brain health. So, Erin, does this all look good? Can you see everything? Perfect. Amazing. So, like I was saying, as Erin really kind of beautifully described, is cancer related cognitive impairment is really biological at the end of the day. And I think many people feel nervous to bring up these changes or changes in memory or focus or mental clarity. But ultimately, there's no need to be ashamed, right? This is happening to so many of us. I'm sure many of the people who joined today are experiencing some of these symptoms. But the good news about all of it is that there are many, many supportive evidence-based ways via nutrition and lifestyle that can support. We're going to walk through kind of my 8 key areas to support nutrition, but also lifestyle based that work together to keep your mind sharp, to help keep you energized, which I would say is another key factor just in cognition as a whole, and really just to stay resilient. So, we're going to dive into each of these, but a brief overview, we've got anti-inflammatory diet. So, think about overall diet quality. We have omega-3 fatty acids, balancing our blood sugar, gut health, our micronutrients, physical activity and movement, getting sound sleep, and then we have stress management and mental health. So I want to start with this overall concept of diet quality. So, an anti inflammatory diet is largely one that's most effective to support brain health because it lowers chronic inflammation. Cancer treatments, stress, even hormonal changes can all increase inflammation, which can then in turn worsen our cognitive symptoms. So, an anti inflammatory diet isn't this big, crazy thing that we have to undertake. It can be very simple. What we want to focus on is colorful produce. So, think bright and deep shades and hues. These foods are rich in polyphenols and antioxidants that are going to help protect our brain cells. We also want to focus on high quality fats, things like olive oil, nuts, seeds, and avocado. We're going to get a little bit more into fats on the next slide as well too. Getting in lean sources of protein. When I think of lean protein, I often think of fish, sometimes chicken and turkey, our poultry as well too. And then our plant proteins really are a phenomenal lean source of protein. We have whole grains, things like quinoa, farro, oats, ideally instead of more refined grains like white rice, white bread, white pasta, but that's not to say that those cannot be part of your anti-inflammatory diet. We have legumes, so beans, peas, lentil, great source of fiber that help give us steady energy. And then one of my honestly favorite parts of this anti-inflammatory diet is the liberal use of herbs and spices. I love to season my food and flavor my food. I think it's so important and it makes food fun. So spices like turmeric, ginger, cinnamon, they're really known to have very strong anti-inflammatory benefits. So I want to get a little deeper, right? I want to talk to you about some of the research too, because I think sometimes we hear about these general concepts, but we don't necessarily know the why or if there's that fact behind it. So, a recent large study published in 2024 reviewed some long term data, meaning they were studying people over a long period of time. And it found that older adults whose diets had a low inflammatory profile, meaning they had lots of fruits, vegetables, nuts, legumes, fish, they had about a 21% lower risk of cognitive impairment compared with those whose diets were more inflammatory. Added sugars, saturated fats, alcohols, these things that can potentially increase inflammation. So when we talk about colorful produce, healthy fats, whole grains, legumes, we're not just guessing, right? This observational data can link dietary pattern to better cognitive outcomes over time. It's in the research. And again, like I said, it doesn't have to be hard. So, one thing you'll hear from our dietitian team all of the time is to take it slow and steady. Maybe you pick one of these categories where perhaps you see a deficit in your own diet and you make improvements on it. Maybe you increase the color of your produce. Maybe you add high quality fats or lean sources of protein, or you're switching to whole grains, right? It doesn't have to be an overhaul, it can be one step at a time. Now, I know we had high quality fats on that last slide. I want to highlight a particular type of fat. Omega 3s are essential fats. Essential, when we talk about food, means that our body can't make it. So you might hear essential nutrients or essential vitamins or minerals. It just means our body can't make it. So we need to get them from either food or supplementation. These omega 3 fatty acids are incredibly important for brain health, but also they can be supportive of mood and reducing inflammation. So, especially for folks who are having additional issues, things like let's say joint pains or things of that nature, these omega 3s, they can do more than just boost your brain health. There are three main types of omega 3s, and I'm going to be honest, I'm not going to pronounce the full names of each of these, but we have ALA, DHA, and EPA. ALA is found mostly in plant foods, so think like chia seeds, flax seeds, walnuts. It's a really helpful form of omega 3s, but the one thing to consider is that it only converts in a very minimal amount to the more usable forms of DHA and EPA. It's about a 10% conversion rate or less, meaning you could have 100 milligrams of ALA and maybe 10 milligrams of it would make it into your body and your cells. So we focus on DHA and EPA a bit more where we can. DHA is a star in terms of brain structure and cognition. It actually makes up part of the physical structure of our brain. So getting adequate DHA, which typically we find in fatty fish, is really important for our neural capacity. EPA is an omega 3 fatty acid that supports inflammation reduction. And it can also help with mood regulation, which is especially important for people who are going through hormonal changes, right? We may have mood ebbs and flows. And so we want to focus on getting in foods that are going to support with more of an even mood profile. DHA and EPA, we find more in these animal forms of omega 3s, which are primarily our fatty forms of fish. Now, again, I want to talk about research for all of these because I think it's important for all of us to understand that, we're not just kind of coming up with these things, right? There's facts behind them. A 2024 meta analysis, which just means a big research study that looked at a lot of research studies, concluded that long chain polyunsaturated fatty acids, so things like DHA and EPA, may improve memory function and attention in middle aged and older adults. And also, and Aaron shared this with me earlier, a longitudinal study examined pre chemotherapy diets specifically and proposed that consuming more of these unsaturated fats and less saturated fats, which are the fats we find in red and processed meats, full fat dairy, it might protect against cognitive impairment that occurs via chemotherapy. So, keeping that in mind, right, these omega 3 fatty acids play a huge role in prevention. Including them regularly could be helpful, right? Evidence supports more of kind of a prevention type of strategy, but when we saw the anti-inflammatory diet, these healthy fats were a component of it. So for most people, getting a consistent amount of EPA and DHA through fatty fish or perhaps a high quality supplement can be especially beneficial to supporting our brain health, mood, and our inflammation. Now, blood sugar stability isn't something that I think we always connect to brain health, but it does play a really major role. Now, when our blood sugar spikes and crashes throughout the day, we might experience symptoms like fatigue, irritability, we can have difficulty focusing. A 2020 study done on people with type 2 diabetes. So, this is progressive diabetes instead of genetic diabetes. It kind of occurs over time. It showed that greater long term blood glucose variability, so the spikes and the crashes, was associated with worse performance on cognitive tests. And this was independent of other factors. So that supports that idea that maintaining stable blood sugar, not just the average levels, may help to preserve mental energy and clarity over time. Keeping your blood sugar even is really one of the fastest ways, especially to improve energy, which I objectively think is a key in improving your mental clarity. Now, this is a topic I love to talk about. I feel like I talk about it all of the time. So, a few strategies to help keep your blood sugar steady. We want to focus on incorporating proteins and healthy fats with our meals, particularly when we're having carbohydrates. So, to explain in brief, when we have a high carbohydrate food, what happens is it digests pretty quickly, and that translates to it breaking down into sugar and our blood sugar spiking because our stomach wants to get that sugar to our brain for energy. When we have protein and fat with our meal, what happens is digestion slows down. So instead of a peak and a valley in our blood sugar, we get a rolling hill in our blood sugar, which is a lot more of what we want to see. So, for example, if you are thinking, I'm trying to get more colorful produce, I'm going to have an apple as a snack. Phenomenal idea, but perhaps we have an apple with some peanut butter. We pair some protein and some healthy fat with it, right, to support the blood sugar. Now, also choosing fiber rich carbs can help. Those are also going to be richer in the fiber that's going to slow down digestion. And then a key, especially preventing the drops in your blood sugar, is to avoid going long periods of time without eating. I know sometimes we don't have the biggest appetite, so maybe setting a reminder on your phone could potentially be something that's helpful. What we know is that our body really ultimately needs consistent energy about every 3 to 5 hours to effectively function. So when the brain doesn't get steady fuel, thinking becomes much harder and much slower. Think about maybe a day that you skipped lunch. By 2 o'clock, you probably couldn't focus on your screen. So we want to get consistent, balanced meals and snacks throughout the day to help with that mental clarity and acuity. Now, I want to dive a little bit into some info on gut health first, and then I'll talk about how we can support our gut health. The gut is strongly connected to your brain through what's called the gut brain axis. This system communicates through hormones, through nerves, and through immune pathways. Now, both menopause and endocrine therapies can shift our gut microbiome, which, if you haven't heard that term before, the microbiome are all of the organisms that are inside of our gut. It alters the types of bacteria that support hormone metabolism as well as inflammation and mood. A good example of this is the estrobolome. So, the part of the microbiome involved in estrogen metabolism. When this system changes, it can also impact cognition and mood. That silly estrogen, it's always impacting everything in our body. Cancer treatment can also reduce microbial diversity and weaken the gut barrier, which increases inflammation. Since inflammation is tied to cognitive symptoms, supporting your gut becomes a direct pathway to supporting your brain. A recent 2025 systematic review concluded that the gut microbiota, so all of those organisms in your gut, had a significant influence on neurological health, including cognitive function, neuroinflammation, and even mental health disorders. Dysbiosis, or unbalanced gut bacteria, has been linked to neuroinflammation and impaired neurotransmitter regulation. That means supporting a healthy gut microbiome could have a ripple effect on brain health, not necessarily just digestion. Now, how do we get these good foods into our gut, and what are those good foods we're looking for? So, a few key categories. We want to focus on high fiber foods like vegetables, beans, fruits, whole grains. These help to feed the good bacteria in our gut. So they're going to be that fuel for the good bacteria. Now, fermented foods like yogurt, kefir, kimchi, sauerkraut, these can help introduce good bacteria into our gut. If you've perhaps recently gone through a surgery and maybe you had antibiotic treatment, that is not discriminatory in terms of it wipes out the good and the bad bacteria. So sometimes we need to repopulate that with things like fermented foods that contain live active cultures. Now, prebiotics, which are also kind of considered that food for our gut and food for the probiotics, things like onions, garlic, oats, bananas, asparagus, and really many of our high fiber foods, as listed above, are going to be prebiotic in nature. And then last, I want to highlight our polyphenol rich foods, things like berries, tea, herbs, cocoa, and our brightly colored produce. They help reduce inflammation, particularly in the gut, and help to nourish the microbiome. So I hope that you're starting to see a trend here that many of the things we're talking about really ultimately end up crossing over, right? It's not that for your gut you have to eat this, for inflammation you have to eat this, for blood sugar you have to eat this. We're seeing crossover with everything. So these foods overall and in general can create an environment that allows your brain supporting bacteria to flourish. Now, there are a lot of different vitamins and minerals that play roles in cognitive function, but a few I wanted to mention that may play more of a direct role. We have our B vitamins. So things like B12, B6, folate, they help with memory, with nerve function, and the production of neurotransmitters. So you'll find most of the B vitamins in things like dark leafy greens, whole grains, legumes, eggs, fortified foods. A lot of foods have B vitamins added to them. Vitamin D, I think, is such a key. Many people are low in it. It supports mood, immune function, and inflammation. The reason many people are low in it is because we most often synthesize it from sun exposure. And for many of us, I know we talked about at the beginning, it's a chilly day here in PA. We maybe don't get a lot of sun exposure for a good portion of the year. You can find vitamin D in fatty fish, in egg yolks, mushrooms, but a lot of people end up needing supplementation, particularly during winter months when sun exposure is low. Now, iron helps us to get oxygen to our brain. Even having lower but still normal iron levels can potentially be linked to some brain fog. Now, I think we all have probably heard before that red meat is a good source of iron, but like we talked about with our heart healthy fats or fats that were going to reduce inflammation and support the brain, we want to kind of skew away from some of those red meats. So I wanted to highlight that there are plant-based sources of iron. We've got legumes, dark leafy greens, fortified cereals, and other foods. One thing I always like to mention is when you have iron with sources of vitamin C, think produce, fruits and veggies, it actually can absorb 3 to 4 times over. And then last but not least, we have magnesium. This is also known as kind of the like relaxation mineral. It supports sleep and calmness, and it's really important for mental clarity. We can find magnesium in nuts, seeds, leafy greens. They're all really good sources. So I feel like there's a couple keys that come through here. Dark leafy greens a number of times. Needless to say, many of these foods we mentioned for anti-inflammatory are key to getting enough of these micronutrients. Now, I think a lot of times we jump immediately seeing some of these things to supplementation. Supplementation is only required when there's not diet adequacy. We want to focus on dietary adequacy first because those are going to be more bioavailable versions that we're going to be able to utilize with a little bit more zest, you could say. Oh, apologies, tickle in my throat here. Let me just take a quick sip of water.
And while you do that, Aubrey, I've been sharing a ton of links in the chat. We've got a lot of nutrient guides. So hopefully, as you are listening to Aubrey and checking out these different nutrients, you've got these quick resource lists of foods that provide these various micro and macronutrients. So check them all out in the chat.
Awesome. Thank you so much. Moving on from food, let's think a little bit about movement, shall we? We'll move on to more of a lifestyle side of things. So, movement really may be one of the biggest brain boosters we have, and you don't need an extreme routine. Gentle, consistent movement can go a long way. Aerobic activities, things like walking or swimming, can increase blood flow to the brain, which can improve energy and alertness. Now, strength and resistance training, like weightlifting, for example, stimulates the growth of new brain cells, especially in the hippocampus. I know that Aaron brought up the hippocampus previously. It's the area responsible for memory. Regular physical activity has been shown to improve memory, processing speed, executive function, and mood overall. Recent 2024 meta analysis of aerobic exercise, specifically in middle aged women and older adults, found significant improvements in working memory, cognitive flexibility, and in inhibitory control. Another study done in 2019, adults aged 20 to 67, aerobic exercise significantly improved executive function and increased cortical thickness in certain brain regions. Cortical thinning is a reduction in the thickness of the cerebral cortex that is linked to neurodegenerative diseases. Other biological evidence shows exercise increases certain beneficial proteins and metabolites like myokines that are linked to improvement in memory and brain metabolism. So, regular movement is not just good for the body, it's one of the strongest evidence backed tools we have for maintaining and really improving brain health. So, sleep, I know I just said that movement was one of the strongest. Sleep is also one of the strongest predictors of cognitive function. I'm sure we can all think of a day we didn't sleep well and we had poor cognitive function. When sleep is disrupted, like hot flashes and night sweats often do to our sleep, it becomes much harder for the brain to consolidate memories overnight. A study done in 2024 simulated the menopause pattern of sleep disturbance. And those women who went through that simulation of like waking, hot flashes, etc., they had more attentional lapses and slower reaction times during the day compared with when sleep was uninterrupted. Moreover, greater night to night variability in sleep efficiency among older adults has been associated with worse cognitive function, which emphasizes the value of regular, stable sleep. So, some helpful strategies: we can keep a cooling environment while sleeping, right? A fan, a cracked window, lighter sheets, maintaining a consistent sleep schedule. Go to bed at the same time, get up at the same time. Reducing alcohol in the evening, that can intensify hot flashes and worsen our sleep. And then practicing mindfulness or relaxation before bed to help calm the nervous system. We want to aim for at least 7 hours of stable sleep, and improving sleep quality often leads to immediate improvements in focus, mood, and mental sharpness. All right, last but not least, we have stress and mental health. They play a huge role in how clearly we think. High cortisol levels interfere with memory, learning, and concentration. I have a classical study. I say classical because it's from 1996 and not from 2024 or 2025. But in stress inducing lab tests, participants exposed to psychological stress showed elevated cortisol, an impaired declarative memory, and spatial thinking compared to when they didn't have the stressors. So that indicates to us that acute stress and elevated stress hormones can directly disrupt memory, attention, and executive functioning. Cancer related stress, right? Trauma, changes in identity, medical appointments, menopause related mood shifts, they can all intensify cognitive symptoms. We have anxiety, depression, and PTSD. Whether diagnosed or not, they can show up as brain fog. And this is why mental care or mental health care is brain care. Strategies like mindfulness, counseling, support groups, journaling, working with a mental health professional can reduce cognitive symptoms by ultimately lowering stress hormones and improving emotional resilience. So, supporting your mental health is not just a factor of your emotional well being, it's equally important in this category of brain health to nutrition and physical activity. Now, I know Erin said she shared a lot of things in the chat. Thank you, Erin. I gave her a long list of things to share. You can find literally all of those things if you scan the QR code. That will bring you to our nutrition hub. You can also just go to uniteforher.org/nutrition, and that will bring up our nutrition hub for you as well. But I'm going to go ahead, I'm going to stop sharing, and then I'll bring Erin up here as well. And did any questions come through while I was chatting, Erin?
We had a couple come through. We had a question about omega-3s and supplements if a person is not getting enough of these foods. And this is one of those foods that I say, yes, absolutely. Omega-3 fish oil supplements can be very helpful, but really important to talk with your physician first, talk with your cardiologist first to see if it's warranted, because they can have an effect on blood clotting as well. So, we know omega 3s, like you said, for brain health as well as heart health. That's certainly something long term we're always thinking about are really beneficial. So if you feel like that's something that you're just not getting enough, make sure you're running that by your physician first. And then just a great question clarifying what fortified foods are, which I think, we learned so early on in our nutrition career. So if you haven't heard the term fortified foods, those are foods that have added vitamins, minerals, other nutrients. I mentioned fiber that aren't naturally occurring. So one of the more common examples, breakfast cereals that are fortified with iron, milk fortified with calcium, vitamin D, orange juice fortified with calcium, that sort of thing. So they're
Yeah.
just a little bit of an added boost. So I love that clarification.
Yeah, absolutely. And certainly, if anybody has any other questions, you can feel free to raise your hand or just come off of mute or pop it in the chat. I think fortified foods are a really great way to get in additional nutrients, particularly for maybe people who are missing certain things. I think vegans, for example, don't get B12 because vitamin B12 is really exclusively found in animal products. But a lot of fortified foods, breakfast cereals, etc., have vitamin B12 in them with this knowledge that there are maybe larger groups of people who aren't getting them.
Absolutely. I love that. And for again, if anyone here wants to share, perhaps if you've experienced some sort of cognitive changes, but have made lifestyle or nutritional changes that have made an impact on your brain health, feel free to share. We love to hear what everyone is doing.
Yeah. And Tamara in the chat said, does dairy cause inflammation and affect estrogen? So that's a really good question, and a question I feel like I get often. And Erin, you can also chime in as well too. But I feel like the link between dairy and particularly like estrogen is just a very unclear link, right? I think that we have maybe research on both sides of the field. Now, what we do know is that high saturated fat intake can impact inflammation, which can ultimately impact the brain health, but also things like estrogen. So, choosing a lower or a non fat dairy option is going to be your best bet. I think dairy can be a really wonderful tool in your toolkit, particularly for something like protein. We've got Greek yogurt, we've got cottage cheese, but I think just making sure that you're opting for a non fat or a 1% versus a whole fat yogurt, cheese, etc., because this is going to be something that's going to have more of that saturated fat that can impact inflammation in it. Usually, I'll also say, opting for potentially higher quality options for things that you're incorporating more regularly to, potentially something like an organic yogurt versus a regular yogurt if you have it every day in your diet. And again, still picking that lower fat option too.
Exactly. Yep. Agree. Great question. Yeah.
Awesome. Any other questions from anyone. I'd like to think that we were just so descript, Aaron, and that is that's what I always say on cooking demos. When nobody has a
I know.
question, I'm like, I just explained it really well.
So well. Well, and they're probably also all checking out the guides, which hopefully, if you weren't aware of all of the resources we have on our nutrition hub, this is just scratching the surface. So if you are someone that, really appreciates just some quick lists of resources and foods to incorporate, these are really handy, easy to use. Resources, bits of information that you're welcome to share. They're open to the public. Certainly, we always say if there's nutrients that you don't see that's part of our education library, let us know. That's always something that we're building out and creating so it is as comprehensive as possible. So, hopefully, just seeing all that is available leaves you with some really good takeaway information that can help you along the way.
Absolutely. And, like we were saying before, is just take it one thing at a time. So I know it probably is overwhelming seeing all of the guides, but take it one nutrient or food at a time, right? So maybe you start with antioxidants, or maybe you start with vitamin B12, or maybe you start with vitamin D, right? And then go from there and build on it. One thing, too, I know Erin put in the chat, and I just wanted to make sure we call out as well, too, is that right at the beginning of what she put in the chat, we've had two other segments on cognitive impairment. We had a Her Speaker series and an Ask the Expert. So definitely, as you're growing on your information and your knowledge about this topic, go back and watch those too, as well, for more info.
Absolutely. We had a great question in the chat. When you have a dietary restriction because of belly bloating and we're told to avoid things like beans and dark greens, what can we do to supplement? So I guess the question is, what sort of nutrient are you looking to supplement in absence of beans and dark greens? Is it iron? Is it fiber? But also knowing that, we can lean into the foods that you do tolerate well. We can look at methods of preparation to ease and support your digestion. So, although there may be instances where foods have to be limited, or we know that they just don't do well with your digestive system, let's work with what we know you do well with, and then we can talk about how you need to supplement and how, if it's appropriate, and what that may look like for you. So, so we want to dive a little bit deeper into that, but there's always ways to work around based on a person's individual preferences, and what they're dealing with in terms of side effects.
And I think too, one thing I always recommend, I think we oftentimes jump into supplementation, but getting a comprehensive metabolic panel before that, because you may not have beans or dark leafy greens, but you may not necessarily be deficient in any particular nutrient. So I know they can be expensive sometimes too, supplements. So I always think, like Erin said, trying to find alternatives, perhaps, maybe even ways to support your bloating, for example, too. I think really great options to kind of pursue as well first.
Absolutely.
And then
Yeah.
somebody also in the chat asked too how to access the Her Library. So I just shared the link, but it's also uniteforher.org/her library. And that'll redirect you exactly to where you need to go.
Yep. Love that. Wonderful. Any other questions?
This was great.
This
I
was
know that
great.
my brain is boosted. So
I'm hoping I sleep really well tonight, is what I'm hoping. And actually, I say that in jest, but I do want to say, how Aubrey mentioned starting with one thing. It doesn't even have to be nutrition. Maybe
yeah.
movement is an area that you want to start building into your day, starting with 10 minutes. Mobility, body work, seated exercises, meeting you where you are. Maybe it is sleep, maybe that's a real challenge for you. And so that's an area that you want to start with to support your brain health. It doesn't have to start with food, but you've got these different options and nothing needs to happen overnight ever. So just working on one thing at a time.
And Jan said, what do you think works to substitute for the nutrients that come from onion, garlic, and peppers? And that's an interesting question because they're really all different, right? Onion,
Yeah.
garlic, and peppers. Onion and garlic are kind of part of the same family. They're part of the allium family. So if you can tolerate similar allium foods like leeks or shallots or scallions, potentially those as alternatives. In terms of peppers, I feel like peppers are oftentimes really seen as a good source of vitamin C, I would say most often. So our vitamin C rich foods are really honestly all of our other produce. So citrus, strawberries, I usually say think reds and oranges. Pineapple, I know that's yellow, but that's another one. Carrots, you can get a lot of vitamin C from those too. So definitely there are alternatives as well. And then I know Wendy also said, let me see, will this be recorded? I think she said. And I said, yes to that. It will be recorded. And then Donna said, how does intermittent fasting affect the brain? And that's a really great question. I don't know that I can speak wholeheartedly on its direct connection to brain health. I don't know if you can, Erin.
It's interesting because I'm working on that blog to come out for December. So a little bit of a tease here. So I think it's inadvertently possibly helpful for brain health. I don't know that there's good research looking at a direct link, but certainly a lot of the things that Aubrey covered, is it making a positive impact on blood sugar control? The times that we're eating, are we prioritizing foods that are more nutrient dense and brain supportive, protein, omega 3s, high fiber, anti inflammatory foods? Maybe there could be a positive impact on brain health as a secondary side effect, but I don't know that there is a primary benefit to it. But certainly, if intermittent fasting is leading to, like I said, improved blood sugar control, improved food choices, higher quality food choices, higher fiber, more anti-inflammatory nutrients, then absolutely there could be a positive effect as a result.
And I love that teaser for that blog that's going to come out. And for those of you who don't know, we do have a monthly nutrition related blog that comes out every single month. We have a lot of hot topics in the
Oh,
nutrition world we've come out with. We've
I
talked
love it.
about seed oils, we've talked about microwaving, we've talked about anti inflammatory foods, we've talked about
Mhm.
sugar. So we love to highlight these hot topics. So, too, if there's anything you think of that you'd like, I'd love to have a blog about that. We are always happy to field ideas as well, too.
Yeah. And one last question. I love this because I think this is relevant perhaps for so many different things. Trying to convince your doctor to prescribe certain tests. I always think communication and sharing why this is important to you, right? So, what you know about it, why it's important, why you think it would be helpful to really give that perspective to your medical team is really important. And that goes with anything, whether it's nutrient tests. And, if your oncologist isn't on board, perhaps you have a closer relationship with your primary care physician and you can have that conversation and you're sort of going another route, not necessarily to go as a workaround, but some of us just may have a closer relationship with one person as part of our medical team versus others. So I think having that conversation, sharing why it's important to you and why you feel like this would be an adequate piece of your overall nutrition health is just really important. So just sharing that perspective.
Yeah, definitely advocating for yourself. I think it's tough
Yes.
because I think we have to advocate for ourselves a lot sometimes, but I totally agree with that sentiment. I think when you can explain why something is important to you, your provider is likely a lot more to work with you on it versus sometimes I think the perception is maybe that it's like a hype or something of that nature, and that's why you're requesting it. So definitely coming to them with your concerns about why you want to do that type of testing, and hopefully they're open with it. And then Wendy said, any clues you can share to know if cognitive health changed because of the chemo or from pain meds? Oh, that's an
Oh,
interesting question.
do you mean like identifying one versus the other? Like if you can identify whether the change was as a result of the chemo or pain meds? Yeah. I think that would be very difficult to with certainty identify one or the other
Yeah.
unless it was a pretty dramatic change shortly after receiving the particular medication, right? So if you're taking a pain medication and 45 minutes later you're noticing more difficulty with finding your words or short-term memory, that may be an indicator that maybe there was a closer relationship between the two and vice versa with chemo. But there's so much overlap between the two as well. I mean, even having pain alone can affect our cognitive health because it affects our ability to get good quality sleep, our ability for movement, our interest in food and eating. So, there's so much overlap there. I think that would be difficult to really clearly determine.
And thanks everybody for hopping in with your questions here. I think we covered a lot today. We
Yeah.
talked about a lot in terms of brain health and cognition. Make sure that you check out those resources. Those are super important in terms of helping you along with your journey. And of course, we're so happy to be able to have so many other education events, even in this short month coming up, right? We've got one tomorrow and two next week, and our virtual education events are presented through UFH Connect with the generous help of our sponsors, West, Merck, Lilly Novartis, and Gilead Sciences, with support from gold sponsors, Pfizer, GSK, and Daiichi Sankyo, and supporting sponsors, AbbVie, TerraSera Therapeutics, and Veristem Oncology.
Wonderful. And I will give quick reminders very quick on what we have coming up. So please join me live on Facebook tomorrow. We are chatting with Sue Friedman from Force. They are an incredible nonprofit partner, streaming live to our Facebook page Friday, 1 p.m. Eastern Time. Join us, check out what they're all about. They serve the entire oncology community. So hopefully you'll join us tomorrow. And then next Wednesday, we have our virtual hangout, Art Therapy, with my lovely friend Jacqueline Carmody from Twist Out Cancer. Please join us as we get cozy together. Wednesday, December 10th, 5 p.m. Eastern. Register on Zoom for that. And then wrapping out the year, I can't even say, can't believe I'm saying that. Our speaker series next Thursday, December 11th, 6 p.m. Eastern Time. Muscle Matters, Fueling Strength and Health After Cancer with fellow dietitian Crystal Zuniga. She's really fantastic. But it'll be a great way to kind of set us off into the holidays and what we can look forward to in 2026. So, again, all of our programs are recorded, including tonight, will be available on our UFH Connect video library, uniteforher.org/UFH Connect. This will be up as early as tomorrow. So, hopefully, I will see all of you over the next week and a half or so. And we appreciate you joining us tonight.
Thank you, everybody. Have a wonderful evening. Stay warm for those of you in cold places, and we will see you soon for another education event.
Thanks so much, everyone. You're welcome. Bye.
Bye, everyone.